This has become the plight of Israel Nkegbe, once a robust chief inspector of police. The 63-year-old now struggles just to draw breath. He's one of a growing number of Ghanaians who struggle with chronic obstructive pulmonary disease, a lung disease that kills 3 million people around the world each year. Nkegbe recalls the moment he first heard that diagnosis.
They asked me, "You have come there alone?" That's why I was with my wife. They said I should call him there. So I invited my wife, and he instructed the nurse to take me to the emergency. In fact, I was scared.
Nkegbe can no longer leave the house.
When I walk for a little distance, my breath, I'll be finding it difficult to breathe. I don't usually travel. And if I'm traveling in my own vehicle, for that one, I'll close the glass. But if I'm not traveling in passenger vehicle, you know the glass is always open. So when it happens like that, sometimes I use a hanky or tissue to cover my nose. But when I reach where there is no smoke again, then I remove it.
Nkegbe is among a growing number of Ghanaians being sickened by a silent killer. The very air we breathe is becoming more and more toxic, according to lead pulmonologist Dr. Samuel Asumeni.
Apart from asthma, there's something we call chronic obstructive pulmonary disease. It's also a form of airway disease. It's noted to also be other exacerbated and potentially also brought on by pollution. Because the pollution can be what is outside or what is even in the immediate environment of the person. It could be home or what is outdoors. And all these have been found to have effect on conditions like that, something like bronchitis, and then also certain pollutants, certain things in the air can also in the long run cause something like, cancer.
And it's not just respiratory problems. Air pollution can cause a range of conditions, including heart disease.
People who also have underlying heart diseases, and then they are also in that same environment, may get worsening of the underlying condition. And as I said, if they are exposed to this pollutant for a long time, may develop new onset cardiovascular conditions. So these conditions are not just trivial. They could worsen the condition. They can even result in death.
It is particularly bad here in Accra, where pollution from vehicles accounts for about 40% of pollutants, according to the Clean Air Fund. Minibuses, known as TROTROS, like these, ferry about 70% of commuters across the city each day. Now, even though laws like the Road Traffic Act 2004, Act 683, make the provision for regulation of quality vehicles, these laws are barely enforced. Here at the Carnation Market in Accra, dirty emissions from aging vehicles are obvious. Drivers and hawkers who work all day in traffic are at the greatest risk. Sadly, they are often the most vulnerable. Richard Akwesiajeman sells belts here. He says he constantly struggles with poor health. Maateko Amashong says she has been selling food items at the Carnation Market for years. She deals with constant congestion and costs. The pollution's also obvious here at Tema Station, one of Accra's most busy transport hubs where cars park and marketeers sell all sorts of goods. It's no surprise then that the local clinic here sees high rates of respiratory-related cases. Linda Yeboaboche has been a nurse here for 6 years.
Within a week, let me give you average, within the week, let's say we had a patient, maybe 50 patients, or then respiratory tries to take about 25 cases. So it's really affecting people here. And most of the market women and the drivers, they don't have any knowledge about it. Even if you talk to them, they don't know that it's the smoke that is causing all those health issues.
Tema Station hairdresser Naomi Amprofi says it is frustrating to have no control over the air they breathe.
Yeah, blapa, yeah, intimi, yeah, real free, and ye be coffee. Yeah, bepe ya no aduane mo ba ha ne ya rie wa ha and ye di coffee. Sika ne benya ni na ya kwa ya sign the hospital. Intimi metu om. So na mo so ntini enso ye de ye wa ha. Enti ya ja mo ya sa ne akaka kira mo se pabacha munum ne kakra ne ngusie ne ye de e koyemu. Ngusie ni so ma ye timi nya ya rie we tirim.
Even here, outside the Kolibu Teaching Hospital, where 43-year-old Akwele Laye has sold groceries for 21 years, the air pollution is constant.
GhanaWeb machine ke be kuma me last week ya wo mi last week bote yo wo mi board machine mi ne ke ekote mi na kan ya na efi otomo itwi nsu imu wa to mo agbogbo shi lo le jin ene kan ame le GhanaWeb machine le ame han mo last wa denche ke Tema Station lorry jin ko me le we han mo last so GhanaWeb machine wo kwa ma ka me lo le jin ame kwa na ma sa shi last we egbewo.
Inside the hospital, medical staff deal with the consequences.
We do see people in the automobile industry, transport industry, drivers, we see mechanics. There is a vast range, and all of them will come with a different types of respiratory condition. Some of them will come with asthma, some of them will come with COPD, some of them will come with lung fibrosis, that's scarring the lungs as well.
Air pollution in Ghana has had little attention before now. It causes at least 28,000 deaths a year, according to the Clean Air Fund, and costs the country $2.5 billion a year, equivalent to 4% of the economy. A recent study found just treating the growing number of sick patients is a burden on Ghana's healthcare budget, says Head of Transport at the Accra Metropolitan Assembly, Alex Johnson.
We estimated about $14 million annually is spent on treatment costs of patients or respondents that have been hospitalized more than once in a treatment facility.
Accra is Africa's fastest growing city. With all those extra people, experts say air pollution is going to become a crisis. The good news is there are solutions. The government, led by the EPA, is working with a range of stakeholders on a plan to improve the quality of the air we breathe. They've developed standards that would force owners to fix vehicles to reduce emissions. The next step is getting buy-in.
We have identified a number of interventions that we can implement if we really want to bring the levels down, and there are various stakeholders that need to come on board. Because when it comes to regulating the emissions of air emissions, not only EPA, other stakeholders also come on board. If you talk about vehicular emissions, DVLA comes in. Transport issues, Ministry of Transport. So we have developed the air quality management plan. The initial one was developed in 2018, and then it was implemented to an extent. And now we are reviewing it to extend coverage to the entire Greater Accra region. So it is almost done, and then this month we are bringing other stakeholders on board. We have shared the draft with them. So we are bringing them together so that we look at their contributions, their inputs into the plan, so that we can finalize it, and then we start with the implementation.
AMA Head of Transport Alex Johnson has a range of ambitious plans that would provide bike lanes and sidewalks to encourage Accra citizens to walk and cycle more. But he has one much more simple solution that could start immediately.
Car-free days, I think they are the most or the lowest hanging fruits we can get, especially in trying to adjust our culture to making sure the environment is clean. And the way car-free days are implemented, they take cognizance of a lot of factors to make sure that it does not affect economic activity. Normally what you have is in other African cities that we know are implementing car-free days. They implement on a regular basis on Sundays between 6 a.m. and 12 p.m. So it's just half of the day. But analyzing the kind of benefits they get even for just about 6 hours of opening up the environment for people instead of cars is quite enormous. It's a pollution reduction strategy. If you keep at it for a very long time, it means that you've taken a significant portion of the day, and consistently you have a multiplier effect as the years go by.
Director Amwa says the real wins will come when the government passes a set of regulations that will force transport operators, vehicle owners, and industrial polluters to clean up their act. The EPA expects to face resistance from polluters, some of whom have strong influence with lawmakers.
If you really want to regulate the quality of air and the quality of air that is being emitted from different sources, we should have a standard that we can compare with. So we have developed a standard, which I mentioned is available. We have two of them, one for the vehicular emissions, and then the other one for ambient air quality, and then point source or stack emissions. So those are for industrial undertakings. So when they monitor, we check whether they are meeting or they are not meeting. But for us to be able to implement the standard, we need the regulations. So we are working on the regulations, and I'm sure very soon we'll complete with that, and then we'll go into full enforcement of the standards.
In the short term, the EPA has been monitoring air quality at 17 locations around the city and has developed a color coding system to alert residents to the dangers they face day to day. EPA Ghana uses a social media platform X, formerly known as Twitter, to alert people to the quality of the air in their community based on a series of color codes. It starts at green and goes through orange and red when sick people are encouraged to stay at home.
When it goes purple, when the index is between 201 and 300, then there is a health alert. So the risk is increased for everybody. Then the last one is when it is maroon. We say when it gets to that level, it's hazardous. That is when the index is above 300. Okay? And that is a health warning for everybody because everybody is at risk.
Health experts say there are things people can do for themselves now. Wearing masks and covering mouths and noses with handkerchiefs will block the larger particles. People should avoid high traffic areas as much as they can, and they say people should start walking and riding bikes more. Not only will you be making the air healthier, you'll be making your body and mind healthier too. This story was a collaboration with New Narratives. Funding came from the Clean Air Fund, which had no say in the story's content. I'm Wanda Amihagan, reporting for GhanaWeb.